Previously on Health Now.
Any bleeding, be it a spot of blood or be it a lot of blood.
So long as you are pregnant.
So long as you're pregnant,
it should not be there.
There should not even be a drop of blood. Okay? Because it's just a sign that your pregnancy is threatening to come out, or maybe there's even a problem with that pregnancy and the body is giving you a sign.
It's warning you.
Yes.
Yes.
So the body is warning you that something is not right. So you need to be checked. So please, if you forget everything I said, there is no normal bleeding in pregnancy. A pregnant woman should not see any blood. So that's the most important sign of first trimester trouble. And the other one is usually pain. Lower abdominal pain that feels like cramps, okay?
Yeah.
The way you would get maybe period cramps, if you experience that in pregnancy, I think you need to be checked, yeah? So there will be a bit of discomfort because remember the uterus is enlarging.
Yeah.
So there will be a bit of discomfort in the lower abdomen, but it should not be crampy abdominal pain. It should just be something, maybe a dull discomfort that's not there throughout. But if you're having cramping abdominal pain, it could be a sign that your uterus is contracting, and contractions of the uterus usually is what will eventually expel the pregnancy, leading to a miscarriage. So if you find any of those two signs in first trimester, please go to the nearest hospital as fast as possible. Then in the second trimester, from 14 weeks up to 28 weeks, another very critical period, because this is when the baby really grows. Yeah, a lot of rapid growth. The baby that formed in first trimester now has a lot of rapid growth in the second trimester. Usually, the more easier trimester of pregnancy, so to speak. Yeah? It's usually a lot
first one
easier.
is more.
The first one can be a bit chaotic.
Yeah.
I'll come back to it because I forgot to mention something.
Yes.
But the second trimester, usually the body has adjusted.
Okay.
The body has adjusted to having a second person. Not much is happening that time. It's other than the growth of the baby.
Yeah.
Your body has already accommodated this second person inside you.
Yes.
But this is also
I'm liking the way you're saying the second person.
Yes, because there are two people now.
Yes.
So during this time, this is when a mother starts experiencing the movements of the body of the baby, and they're very excited.
Yeah.
Yes, and what we tell moms is remember, in the whole world, no one else knows how that baby plays. You're the only one who knows how that baby plays. So we usually will ask you to monitor for us how active your baby is. Because I would not know. Even the father of the baby will not know. Only the mother of the baby will know.
True.
So from around, for people who are first-time mothers, they will start feeling the fetal movements between 18 and 20 weeks. For someone who has delivered before, they'll feel it about 2 weeks earlier, 16 to 18. The only difference is because a first-time mother has no idea how it feels, but someone who has delivered before will then start appreciating it earlier. So we usually tell you, monitor for us how active the baby is. And if you notice a significant difference, then maybe you need to go to hospital. Because that's why sometimes someone will come and say, my baby has not played for 5 days. And I want to scream my head off. Because I'm asking, where were you for 5 days? Yes, it happens. It happens, and that's why we are here, so that it stops happening. Monitor for us how your baby is playing. If you notice a difference, don't wait for the baby to stop. Just come and say, my baby has reduced movement. Maybe you could check if there's a problem.
Yes.
And usually we will do a scan to check whether there's anything wrong.
Yeah.
Okay? So this is also the time now the water of the baby fully forms.
Okay.
So the waters of the baby in first trimester is very little, but now in second trimester it's a lot.
Yeah.
So we tell you that if your waters ever break at any time, please run to hospital.
Anytime.
Even if it's at night, get a taxi and go to hospital.
Speak to us.
Yes.
Speak to
Don't
us.
come for after 2 days and
Please
say,
talk to us.
my water has been leaking for the last 2 days.
Uh-huh.
Please come as soon as it happens. Sometimes it's not even the water. Sometimes it's other things, but we'd rather tell you it's not your water that has broken. You probably have an infection, and we just treat the infection and you go home, as opposed to coming after 3 days and saying, I have been, your water broke 3 days ago. And my question is, where were you? You get. So we want you to come as soon as it happens. So the second trimester is also very important because this is when most of the other diseases that can complicate pregnancy usually will start showing up. Okay? So one of the most important diseases, as I had said earlier, is what we call hypertensive diseases in pregnancy, mainly preeclampsia. And as I said, preeclampsia is now the second leading killer of women during pregnancy and childbirth after bleeding. Okay? So the hypertension of pregnancy, again, the risks is extremes of age, below 20, above 40. However, it can happen in any age, but the more common the more common age is below 20 and above 40 years. Then how will it present? How do you know? You start having a severe headache that's not going away. Then your body starts swelling. So most of us will have leg swelling in pregnancy at one point or the other. But if your face is also swelling, your hands are also swelling, especially when you wake up in the morning, then probably it's time to get checked. It can also make you get what we call a blood vision. You're wondering, why are my eyes not clear?
Oh, and am I not seeing well?
Yes. And that's why you notice every time you come to the clinic, we take your blood pressure because we know that this is usually one of the commonest diseases that complicate pregnancy. The other one is diabetes. This is also the trimester when it will start happening, and if we don't look for it, then we may end up losing the baby now in the third trimester. Because most of these things, if you don't correct them early, then you get the repercussions in the third trimester when everyone is waiting for the baby. Okay?
Yeah.
So second trimester is quite fairly an easy trimester for most women, but also the trimester when other medical conditions, especially those two. Those two are some of the commonest complications, diseases that complicate pregnancy. That's when they start showing up. And you'll find us screening again for diabetes between 24 and 28 weeks. Even if we had tested your sugar in first trimester and it was normal, you find most of us will screen it again between 24 and 28 weeks, which is within the second trimester, even as we continue to monitor the blood sugars. Maybe to just mention something that I did not mention in first trimester. First trimester can be chaotic for some people. It can be very, very distressing for some people. Because remember, your body is adjusting to accommodate another person. So the morning sickness that comes, morning sickness is actually one of the most frustrating events in a pregnant woman. So you're vomiting because your body is basically adjusting and there are hormones that are coming in with it. So most people will go through it without an issue. I mean, vomit in the morning, but the rest of the day you're okay. But there are some who it's extreme and we actually have to even admit them. So
the vomiting?
Yes, the vomiting can even cause your kidneys to shut down because you get dehydrated. You're not retaining anything. Everything you take, you vomit it. But what I would like to tell women is don't suffer. Don't suffer in silence. Don't suffer because we say it's normal. There are medications that will help you to make it more bearable.
Yeah.
We may not completely take it away, but we should be able to do something to allow you to at least be able to eat and drink something. And if it's too much, then we admit you.
That point that you've talked about, the kidney, kindly go back.
Yes.
Kindly.
Yes. So
yes.
I will say again, we have seen pregnant women go for dialysis because of kidney failure from vomiting from morning sickness.
And you know, people joke, they
Yes.
say that a pregnant woman only know one letter, O, as they vomit. You know, people just joke like that with a very serious thing that now you are talking about.
Yes, we have seen it.
They say that a woman who is pregnant, they only know one letter. They're O, as they vomit in the morning.
Vomiting in the morning.
Surely.
No, it's not. Don't take it lightly. By then, don't take it lightly. Don't let people push you to think that it's normal. Because, you know, most women will be told these things happen in pregnancy, or you're not the only one, or you need to be strong. No, if you're vomiting too much, you're not able to retain anything, please come. Because your kidneys can easily shut down. You end up with dialysis because of vomiting. Yeah? So it can actually happen. Women have even landed in ICU because of nausea and vomiting of pregnancy. So don't suffer in silence. We can make it more bearable. The good news, though, is most people, by the time they are 12 weeks, it gets better and they actually forget and they get pregnant again. Yeah, that should tell you how easily we forget. Because the joy of the pregnancy outcome usually makes us forget all those things we went through. And remember that sometimes if your sisters get very bad nausea and vomiting of pregnancy, you're likely to actually also get it. So you'll find that there are some girls in this family, they get really bad nausea. And then there's some women who don't get it.
Yeah.
Good for them. Yeah, but remember, don't suffer in silence. If you're not able to take anything, please come see a doctor. The doctor will give you something that will reduce the nausea and the vomiting. Yeah, and that is why most pregnant women in first trimester actually lose weight. So you come to the clinic, you're pregnant, today you're 50 kilos, in a month's time you're 44, and you're wondering why.
You're talking to one here.
Yes. It's just
I lost.
Yes.
At some point I was 45.
Yes.
Yeah.
Most women in first trimester, because you're not able to eat because of the vomiting. That's how bad it can get for some people. Yeah, so don't suffer in silence.
And you know, people will compare and say, what they vomit.
No, of course, if it's not so bad and it's bearable, it's just in the morning and the rest of the day you're fine, that's okay. But if it's so bad that you're not able to retain any fluids, then maybe it's time to see the doctor.
And that is what you keep saying. Yes. That is why we are here.
That's why we are here, so that we can share this information and demystify some of these things. And I mean, just let women know that don't let people silence you because of their experience.
True.
Because my experience and your experience really are two different things. Even your own experience with different pregnancies is usually very different.
Oh,
yeah, you could have one very easy pregnancy, and the second one is just chaotic. Yeah, so experiences are different for different people. Yeah, then now after the second trimester, usually, as I said, more easy trimester, because not in terms of your body changing, that has already happened in the first trimester. Then we get into the third trimester from 28 weeks to 40 weeks. And this is now also a season of the baby maturing. Most of those diseases can also now start manifesting. The hypertension in pregnancy, preeclampsia, the gestational diabetes can also start manifesting in third trimester. This is also when people lose babies. You know, you come and say, my baby stopped playing 3 days ago. Okay, so we need to be more vigilant, especially in terms of the movement.
Yeah.
How is your baby playing? This is also a trimester where now the effects are more physical. The first trimester, the effects are more what we call physiological. Is your body changing na uko ndani? But now this one is, I am tired. My back is aching. my legs are swelling.
Yes.
So the effects of the pregnancy in this trimester are more physical, and it's just because of the weight of the pregnancy. Yeah, so most women will get back pain in pregnancy in the 3rd trimester, and it's because of the curvature of your back, because as your tummy is growing, the curve on your back increases, and you cause a strain on the muscles. So we ask you to rest as much as you can. Then your legs will swell at some point for almost everybody because of the pressure of the pregnancy on the blood vessels of the legs, because now blood is not able to go back as fast as it was, because there's something compressing the blood vessels at the level of the pelvic bone. And then of course now this is when I can't sleep, I can't find a comfortable position. It's very common, insomnia in the 3rd trimester. Most times not much we can do.
Kuna kitu utanipe ndio nilale.
No, if it's really bad, we give you. Because remember, in pregnancy, we also want to avoid drugs as much as possible. But if it's really bad, we can give you something in the evening to make you sleep better. And then also we tell you, look for a comfortable position to sleep in. So the effects are more physical, but it's also an exciting time because now we are anticipating a baby. Everyone is excited, is looking forward to it. And that's why we tell you, please monitor how the baby is playing. And if you're not sure, if you notice something happening and you're not sure, just ask. Go to the hospital and ask, is this normal? Should I be worried? This is also now the time when we make a birth plan starts now it starts early in 1st trimester. We start having a birth plan, but now this is when we solidify it. Is your baby in a position where you can have a normal delivery? Ama anatoka na miguu. Then we will have a cesarean section. This is when we set the dates. We tell you, if you haven't gone into labor by this day, then you need to come and have an induction, or your baby is not lying properly, we need to have a cesarean section, and we will have it on this and this date. This is when we discuss, how do I know I'm in labor, you know, and what do I need to do? This is when we tell you, pack your bag and keep it next to the door because you could leave it. Have a number of a taxi driver.
I like the way you put it.
Yes, people have showed up and said, oh, my bag was in the wardrobe, but you know, when labor happens, people panic and you don't remember. So keep it where as you're exiting, you can see that it's on my way out. So this is also now when we tell you have the number of a taxi driver, so that if things happen at night, then you have access to the hospital. So basically 3rd trimester, solidifying everything that has been happening and now coming out with an exit plan because the baby is about to exit. So we discuss how do we go, which is your hospital of choice, which is the plan B, because I may have planned to go to a hospital in Nairobi, I'm in Kiambu, but my baby comes out on the way, or I can't reach there. So you need to always have a plan B. And we usually insist that as we are discussing your birth plan, who is your birth companion, okay? Who would you like to be there with you when you're giving birth? Is it your husband? Is it your partner? Is it your mother-in-law? Is it, you know, your sister? So we have those discussions now in the 3rd trimester and tell you that you could go into labor from this date up to this date. So anytime there, in those days, you need to be ready. So basically that's it with the 3 trimesters.
The 3 trimesters. Now we are pregnant, we are ready to deliver.
Yes, we are ready for the baby.
Before we close this this episode today, there's something that I would like us to go back to. You talked about the blood groups. How early should somebody be tested? Probably when a girl is it advisable when somebody is growing up, or we should just wait until when somebody is pregnant?
No, we should not wait until. It's just a bad culture in our setup. I'll call it a bad culture because, Jane, it's like you walking around for, say, 26 years,
Yes.
and you don't know your second name.
It's not possible.
It's unacceptable.
Yeah, it's not even
Yes.
possible.
So
Yeah.
know the blood group of your children.
Ali.
Yes. You know why it's important? Sometimes I'm sure you've had people making distress calls that, oh, we are looking for someone who's blood group A positive to donate blood for a relative. How will you go and donate if you don't know your blood group? And you could save a life.
True.
You get?
Yes.
You could actually be the person who saves that life, because you could be having that rare blood group that they are looking for. But if you don't know it, then you can't. So know the blood group of your children as early as possible.
Yes.
Because you never know. You never know. Like now, the people who I said are blood group negative, you know, we face a lot of challenges when they need blood. And some of the things they have done, they have WhatsApp groups, because there are very few.
Yes.
They have WhatsApp groups in the whole country, so they know each other. I've had to maybe do surgery on rhesus negative people who needed blood, and they just post in that WhatsApp group and say, I am having surgery in Kiambu. I am blood group O negative. I need 2 units of blood. And people you have never seen, you don't know, they show up, donate blood for you, and it's available. How would you do that if you didn't know your blood group?
You didn't know.
Yeah, so you should know your blood group as early as
possible. And I think that is a very important point to make. Somehow I came to know about that. And when my 2 girls were small, I actually did for them.
Good.
So I got to know, and both of them are positive because their dad is negative.
You see why you should, you have a very good health-seeking behavior. That's why you run this health show, so that you can influence other people.
Thank you.
So you should know your blood group as early as possible.
Yes. So when I came to know that, and now because the dad is negative, I did my 2 daughters. Both of them are positive. But I feel it is important for us and to know this and to do it early.
Yes, absolutely.
For those of us who have daughters, even probably even those young people that probably are planning to get married, they need to get to know their blood group so that, something like that. Probably as a parting shot, you could just look into the camera and, share something. Yeah, okay. Tell us something.
Yes.
Yeah.
So thank you, Jane, for the show. And to our viewers, I want to repeat, please go to the doctor before you get pregnant, if you're planning to get pregnant. And especially if you're someone who has any medical condition and you're on any treatment. If you have lost a pregnancy before, please let us see you before when we can intervene. If you have a strong family history of some of these diseases like hypertension and diabetes, and if you don't make it to go see the doctor, go to a chemist, buy folic acid, take it for 90 days, and continue even when you get pregnant. Continue taking it for the first 3 months. Go to your doctor as soon as you realize you're pregnant, so that you can be evaluated. We check whether there are any risk factors in you, anything that could put your pregnancy at a risk. For those who are pregnant, monitor the fetal movement, the baby movements. For us. In the whole world, only the mom knows. And we always say the mother communicates with her baby. So when a mother shows up and says, I have a concern about this baby, we never take it lightly, because the rest of us don't know how you and your baby communicate. Okay? So let us make it easy for you and make it easy for us to walk with you through the journey. And remember, we said the doctor has their part to play, and the pregnant lady or the woman has an even bigger part to play. Because if I write for you supplements and you don't take them, then, my hands get tied, yeah? So I advise all women, please make it routine so that we can walk with you this journey until the end of your pregnancy. even as you enjoy your bundle of joy, so that it doesn't become a bundle of tears, it becomes a bundle of joy. And the only way to do that is by making sure that you stick to the instructions that we give you. When we tell you to come to the clinic, please come back. When we tell you look out for this and this, please look out for it and inform us. Thank you so much.
Yeah, and probably before we just call it off, the contact, probably there's a viewer there that would like more information, more personalized care. Probably you could share where they can find you.
Okay, so I am at Doctor's Plaza. Doctor's Plaza is on ground floor of Kikinga House Annex, which is next to KCB. And our phone number is 0707 262 948. 0707 262 948. And you ask for Dr. Maina, then they will connect you to me.
Thank you so much, Daktari.
Thank you.
Thank you for taking us through the pregnancy. And next week, our next episode, we'll look at now delivery. But for today, I would like we stop there. God bless you. Thank you so much. Stay tuned always to Health Now Show, your health friend. God bless you.